The Webster technique, a method to facilitate the turning of the breech fetus. The Webster technique, a history. The Webster technique was developed by a chiropractor named Larry Webster, who also founded the International Chiropractic Pediatric Association in 1978. The ICPA maintains that the Webster technique is a specific assessment and diversified adjustment for all weight-bearing individuals and is utilized to enhance neurobiomechanics in that individual. So really what they're trying to emphasize is that it's not specifically for turning babies. It's not specifically for the malpresented fetus. And really it's for all people. So the Webster technique addresses musculoskeletal intrauterine constraint and the alignment of the sacrum within the pelvic basin. And essentially what the Webster technique has been popularized has been to address breech presentation. So what is the technique? So many fetuses in breech presentation before 34 weeks gestation will automatically turn, yet not so many will do so after 34 weeks. And so what the Webster technique actually is they assess the alignment of the sacrum, and then they align the sacrum within the pelvic basin, which I said before. And there's also the use of massage, abdominal effleurage, and stretching of the attachment points of the broad and the round ligaments in the, that attach to the abdominal wall. And these are performed on a regular basis. In this slide, it shows where on the woman, on the pregnant woman, where the gentle abdominal effleurage takes place, but also a lot of the stretching and massaging as well. So how does using this technique help a breech fetus turn? Well, there's, the whole technique is really the combination of the chiropractic adjustments on a regular basis and the stretching. And they serve to decrease the musculoskeletal intrauterine constraint. So the intrauterine constraint here is defined as any force external to the fetus that obstructs the normal movement of the fetus. And so by balancing the pelvic basin and reducing the muscular stress on the uterus and the supporting ligaments, that it supports the vertex presentation. And theoretically, this allows for more room for the fetus to turn from breech to vertex. And I wanted to show you this slide of a twisted pelvis. You can see right here at the bottom is the pubic symphysis, and you don't see a consistently round opening, and this one was said to be also kind of twisted in other directions. And so in this case, what the chiropractor would do is make adjustments to the sacrum, lower back, and loosening up the ligaments that have been holding this pelvis into place and causing constraint. So this next slide shows a well-aligned pelvis. You can see that you can't see the pubic symphysis. You can see a marker right there at the bottom where it is aligned with the sacrum, and there is a nice rounded pelvic basin for the head of the fetus to descend into. So concerning safety, response of the patient, and outcomes. The Journal of Manipulative and Physiological Therapeutics reported that there is an 82% success rate of fetuses turning vertex when the Webster technique has been used. Another study claimed 92% success rate, and yet another study said that 102 out of 112 breech presentations were successfully turned to vertex presentation. I think that says a lot right there. So the practitioner does not attempt to change the position of the fetus, and the technique is non-invasive. And what the chiropractor will do there's a special pregnancy table where the bottom of the table drops out to make room for the expanded belly. And so from there, they use light force adjustments. So again, apologize for my dogs. The chiropractor uses light force adjustments, as I said, and the drop table. So what that is part of the table just slightly moves, and that is able to move this, the sacrum slowly out of a stuck position, I guess is the best way to put it. So no adverse outcomes have been reported directly related to the use of the Webster technique, which is also a fantastic result. Pregnant patients are recommended to have the Webster technique adjustments during their entire pregnancy due to the effects of relaxin on the pelvis and the sacrum, meaning that everything is pretty loose. So when you make an adjustment in the pregnant woman, that adjustment doesn't stay as long as you're retraining more or less the muscles to keep the sacrum in alignment and the ligaments therefore much more relaxed. But there is one word of caution. There can be comorbidities involved in breech presentation of the fetus, and that this needs to be taken into consideration. For example, oleohydroaminos is a possible reason why the pregnant woman has that the fetus has breech presentation. So that is to be kept in mind when you are getting cared for by a chiropractor, is to not discontinue your OBGYN care. So other methods to turn a breech fetus. So another method is called external cephalic version, and this is usually performed by an OB. This can cause severe maternal discomfort. The average rate of success is 58%, and there's actually a fair amount of risk involved, which can be placental abruption, preterm labor, premature rupture of membranes, to name just a few. And the other technique that is relatively well known is called spinning babies, and it's a daily exercise approach to releasing tension in the hips and the pelvis, which facilitates the fetus turning before birth. And in a lot of ways, it has a similar take as the Webster technique, as in trying to release tension and allowing more room for the fetus to move. And this last slide is all my references. Thank you so much.